What is your ideal workplace? How do you know how to find it? What are candidates looking for? An ideal fit between themselves and their workplace, vocationally, with a shared vision and a high level of professionalism, a competitive salary and benefits, meaningful supervision, manageable caseloads, minimum paperwork and the time to complete it, the opportunity to grow and stay current in their field, flexible hours, excellent therapy materials and clinical resources, a technologically advanced working environment, an absolute commitment to the patient and their families, one-on-one therapy in their own dedicated workspace, an excellent support staff, a collaborative environment between themselves and their colleagues. When you look at this list, you will find that very few venues provide all or even a majority of the listed items. So think about it. Taking all of those factors from the previous page into consideration, how satisfied are you? Would love a new opportunity? Not satisfied with your current placement? Moderately satisfied with your current placement? Satisfied with your current placement? Very satisfied with your current placement? Would not change for any reason? Go ahead, pick one. Let us give you some facts. This U.S. Business Conference Board survey tells us that just a little, 51%, of all U.S. employees are satisfied with their job. That means 49% are not. However, speech and language professions fared better. ASHA's numbers are better because overall salaries and benefits are generally higher than in the general workforce. But even here, 25% of clinicians are not satisfied. Additionally, this survey was black and white. Either you were satisfied or not. This did not address the nuances of the satisfaction range. For example, the study completed at the University at Northern Iowa showed the mean average satisfaction rate was about 77% and did account for age, gender, educational level, salary, and practice setting. But this still leaves 23% unsatisfied. So, who are we looking for? That's an easy question. We are looking for those few who refuse to settle. This includes all graduates or clinicians who have been in the field for any length of time, CFs, SLPs, or SLPAs who can understand and appreciate other venues compared to ours. But let's be honest and upfront. We are very selective. That's right. Like the Marines, we're looking for a few good women and men, and we're exclusive. Why do we feel we can be so particular when the market is so tough? Again, the answer is simple. We know those who work with us are particular, and so are we. We are Lynne Alba's Speech Therapy Solutions, PC, a private clinic located in Torrance, California, in the Los Angeles area. Patients in a private therapy clinic simply expect more. They don't want a one-size-fits-all approach. And they don't want themselves or their children to be treated in an assembly line-like manner. They want to feel like they are being treated as the unique individual that they are. They expect a higher level of expertise and professionalism. They are not getting therapy for free, and private therapy is expensive. In other words, a career in a private setting is demanding, so clinicians have to want and appreciate what it has to offer. We offset the demands with great working conditions. A computer in every treatment room, personal iPad, private treatment rooms, a modern, clean facility, a kitchen with coffee and snacks, medical, dental, vision insurance, flexible hours, consistent treatment with patients over time, 2,000 books, toys, and other therapy materials, paid seminars, the latest testing materials, a one-on-one mentoring program, meaningful supervision, everything else you would expect from an excellent clinical practice setting. What does ASHA say the most important factors are for SLP applicants? Here are the factors and what we do about them. Work-life balance. You will have transition and prep time between patients. You will have assigned paperwork time. We offer personal mentoring every 2 weeks, along with staff education meetings every week. 27 days of PTO, 1 hour for lunch, and at least 2 15-minute breaks. No bureaucracy to deal with. Income and benefits. Competitive pay with most venues. Health, dental, and vision insurance. Paid seminars and conferences. Payroll is direct deposit on a weekly basis. A meaningful job. One of our current projects, empirically tracking and graphing patient progress via computer from goals. We have a strict cancellation and makeup policy to ensure consistency and continuity of therapy. We graduate patients only when they have achieved their maximum communication potential. We see patients across a span of over 100 diagnoses, which means interesting and stimulating caseloads. We are also studying the use of lifelike robots for therapy purposes. Our practice utilizes the most modern electronic technology. You have the ability to participate in special paid clinical projects. We develop professional goals with you and help you meet those goals. Manageable caseloads. We limit your caseload to 26 to 30 hours per week. Caseloads average 34 patients. Per ASHA 2018, average caseloads in the schools are 55. We are 39% less. Most therapy is one-on-one, but a few patients are seen in groups of 2 to 5 within your caseload. Schedules. Schedules are completely managed by operational staff. You are never required to schedule. Supervision. We pride ourselves on our meaningful supervision. All full-time SLPs have a private meeting with Lynne Alba once a week. If you feel you would like to explore your options with us, we are always recruiting the best SLPs, CFs, and SLPAs. Please feel free to call Lynne Alba at 310-856-8528 or email her with your resume at lynn@childspeech.net. Explore our comprehensive website at Lynne Alba Speech Therapy Solutions PC. Once inside the site, please listen to the introduction. If you are looking for more information on a career with us, just click the Jobs button for an extensive and comprehensive look at our employment career package. Click on the Video button to take a tour of the clinic or see therapy in action. Thank you for giving us your time.